Chapter 6 Medical Practitioners 2 Hospital Staff. The people who work in any type of workplace, including hospitals, are called the staff, the medical staff. In a British hospital belong to one of four main groups: a pre-registration house officer, PRHO, or house officer, is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for this junior doctor is Foundation Year 1 Doctor. A senior house officer, SHO, in the second year of postgraduate training, the title is now Foundation Year 2 Doctor, but the old terms Senior House Officer and SHO are still used. A specialist register is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialties, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams, which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clerks them, takes their medical history, and examines them. Sometime later, the registrar also sees the patients and may order investigation or tests, for example, X-ray or an ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward runs when the management of the patient is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by a team and a nurse, and they visit all the patients in the consultant's care. Shift. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m., and are there free until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return to the hospital if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in rota or list of names and times. Doctors on call carry a radio, paper, or bleeper, a device which makes a noise when someone is trying to contact them. Exercises. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate house on provisional radio ward. Call diagnosis officer pager round specialist. Match the descriptions 1 to 5 with the job titles A to E. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. Dr. Stewart has just started the second year of her foundation program. Dr. Singh has started his training as a surgeon. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. Dr. Miller is in charge of the medical staff in the Brigham Hospital. Specialist Registrar, Medical Director, Consultant, SHO, PRHO, or House Officer. Are the following statements true or false? Find reasons for your answers in A, B, and C opposite. A medical graduates become registrar 2 years after graduation. The system of training doctors in Britain is called the Foundation Program. The name Senior House Officer is no longer used in Britain. The consultant is usually the first doctor to see new patients. When working in shifts, all doctors take turns to be on call. Complete the test of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who has on duty during the last to find out if there have been any news. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her work, and I have to make sure I'm completely up to date on her patients. After that, there are usually a lot of things to do, like writing up requests for blood, and so on. In the afternoon, I have to prepare for any patients who are to be. The next day, they're usually happy to be going home. And then, of course, there are lectures and tutorials in the program on Monday and Wednesday.